We are joined by Dr. Jim Kravec, Chief Clinical Officer at Mercy Health Youngstown. Thanks for being here.
Thank you for having me.
You grew up in Youngstown, went to Cardinal Mooney and YSU before medical school. Explain what your role is now in your current position.
So I serve as the Chief Clinical Officer for Mercy Health Youngstown. So Mercy Health Youngstown is the parent company of the three hospitals, St. Elizabeth Youngstown, St. Elizabeth Boardman, St. Joseph Warren, as well as our physician practice sites. We have 25 or so physician practice sites from southern Columbiana County to northern Trumbull County, and really everywhere in between. So as the Chief Clinical Officer, I oversee the clinical quality of the hospitals, the medical staff, our coordinated network, and the strategy and growth of those areas, as well as it relates to the physicians and the growth of the area.
I was curious, when you were in medical school, is a pandemic like this something that you studied about, the possibility? I mean, how much of that was actually in your training?
So I was in medical school from 1998 to 2002. And so we learned about the Spanish flu in 1918. We learned about all the infectious diseases that we knew of them, but we didn't learn about what would happen in a pandemic. We learned about past ones, but not thinking about it. I don't recall. But that said, when I was in residency, I trained in Akron. I was in Akron from 2002 to 2005, right during SARS. So I did learn about that. It never really touched us tremendously in Akron back then. We learned about it.
You mentioned the Spanish flu and now COVID-19. Do you see this as a 100-year event moving forward, or do you think these viruses could become more prevalent? I know there's a lot of talk about with climate change, with deforestation, that potentially there could be a spread of other viruses by mosquitoes or what have you, leaving those areas and possibly moving to other parts of the world.
Yeah, I'm not really sure. I know we talk about the Spanish flu and then now COVID as 100 years, which is true. But again, in 2002 we did have SARS. We had the MERS, Middle Eastern Respiratory Syndrome, in 2012 or 13. And so it's been about every 10 years of something. Those weren't of this magnitude for sure. But I do wonder if it's going to happen more frequently. I also know that the travel is much different now than it was in 1918 with the Spanish flu. So when there is something, I think the travel is, we're all over the globe quicker. And so I think the spread can happen easier now. But I'm not sure if it'll come more frequently.
So what positive, I guess, has come out of this in terms of moving forward if there were to be another outbreak of a different virus? Like, what have we learned, I guess, at this point?
So a lot of positives. And I mean that even if you think of from March and April to now November, December. In March and April, it was all-encompassing of what many of us in the healthcare world did. And in my administrative role, it was all-encompassing. And now it's very encompassing, but we also are still moving forward with a lot of our strategies and our growth and taking care of patients with other comorbidities. We learned, even just in a few months, of how to manage with COVID, not COVID or nothing else. So that was one area. I do think we will be better stocked up on PPE, for example, on medications, on ventilator supplies. And we always had contingency plans, but may not have been as stocked up as, and this is for hospitals across the country and the world. I think those are some positives that came out. The other positive I saw is really how we cared for patients has changed a little bit. The virtual care, that's been interesting. Virtual care was almost non-existent prior to March and April. We had some electronic visits where you would email your doctor back and forth, but actually doing video visits on an iPad was not that prevalent before. And from the patients didn't like it, the doctors didn't like it, and the insurance companies didn't like it. Mm-hmm. Well, now they've been accepted by patients, doctors, and insurance companies, at least for now. We'll see where that stays. So I think that's a positive. I talked to a surgeon yesterday who said, when people get their colonoscopy, they always see the doctor prior. And for the most part, it's to answer questions about the procedure. And he's using virtual visits as a way to interview the patients without them having to come in. So that's a positive change. I don't see that necessarily going away.
Anything interesting come out of the Spanish flu, to help us with public health?
Yeah, I think it's funny. I was reading recently about the Dixie cups, those little paper cups that we in the bathroom and kitchen that we have that are throwaway. And if you read about that company, it was founded right after the Spanish flu. Everyone was using glasses and glass cups in their kitchen and bathroom prior to that, for the most part. And a gentleman invented plastic cups to say, well, seems to make more sense. We use them and throw them away. So I do think that that came out of the Spanish flu. I'm sure there's many other things that came out of that. I know the shaking of hands has changed after that for a period of time, then it's come back. But I think that we will see changes now moving forward. If I look back,
sanitizer dispensers
hand sanitizer
everywhere.
dispensers everywhere. In the grocery store, the plastic shields
Sure.
are up. In medical facilities, people wearing masks. I think that may be a commonplace for some period of time. Maybe not in churches and grocery stores, maybe not when everyone's vaccinated in a couple of years now, but in healthcare facilities, maybe not. So I think that's kind of where some of the changes, I think, may come about. If you think of September 11th, 2001, in airports, for example, prior to that, we were walking up to the gate. We'd be able to walk through and watch planes take off. I remember as a kid doing that. And now you just don't even think of that as ever being possible. You just have to stop at the security check. So there's some things from that event 20 years ago that probably will never go back. And I think we're going to see some things now that may or may not ever change.
Can you basically give us an overview on where we stand in terms of COVID and how the capacity is at the local hospitals today?
Yeah, I think we saw a spike of patients in March and April, and we spent a lot of time talking about that. And it was a lot of patients, both in the outpatient setting at the Mercy Health flu clinics, but also in the 3 Mercy Health hospitals, a lot of patients. And so that was in the spring. And now we are higher than that. So early December, as we're talking now, we're higher now than we were in March and April. There are a lot of patients in the hospitals. There are a lot of patients in the community as well. People say, well, is this just a lot of testing? We're testing more. Well, that's true for the outpatients, but those that are sick enough to be admitted in the hospital are sick enough to be admitted in the hospital. So it doesn't matter if they're tested or not. In an outpatient setting, they're sick. So the hospitals are very busy. The staff's very busy in the ERs, in the intensive care units, on the regular general floors of the hospital. But we're taking care of those patients. They're busy. A lot of the units are full, but our staff's very, very good about moving patients through to other parts of the hospital or sending them home when they're ready to be discharged.
How has that changed the hospital's procedures and protocols in terms of visitors, in terms of elective surgeries?
Yeah, we've made some changes. The first change we made in the fall now, as we are into November and December, is eliminating visitors. And that was important because what we were finding was visitors were coming in who the next day might be positive or have a cough, and we wanted to minimize the risk for other patients and staff and anyone else. So the visitors were stopped, temporarily, but still stopped.
For any patients?
For any patients. There's a few opportunities for visitation if someone's at end of life. If someone's having surgery, they need to have someone there with them. If it's a minor, if someone's having a baby. So there are a few exceptions and that we work through for those type of areas. But for the most part, across the board, it's no visitors. On Thanksgiving, we stopped elective surgeries that require an overnight stay. And if you think about the 3 reasons why we might stop procedures, one would be PPE. In the spring, we had a problem with that. We don't necessarily now. All the equipment, masks, gowns, et cetera. One is hospital space, meaning the rooms that those patients take up. And then third would be the nurses and the staff taking care of those patients. So really what we decided was, those patients with an elective procedure that would spend the night and take up a hospital bed for a night or 2 after that, we won't do those patients for now. That way we save those hospital beds and those nurses taking care of those patients in those hospital beds for COVID-19 patients.
How are the frontline workers doing, the doctors and nurses? Are they working a lot of extra hours at this point? And what are you hearing from them?
They're working a lot. They're tired. We heard from one of our emergency room nurses who spoke in Governor DeWine's press conference recently, and she was very eloquent about the staff is tired physically and mentally. And I think she summed it up perfectly. They are. They're working a lot of hours, and it's stressful. They're thinking, will they take it home to their families? Will they spread to someone else? So they're tired. That said, they're amazing. The staff's doing a wonderful job. The doctors and nurses, the respiratory therapists, the other techs we have, the food workers, the maintenance staff, cleaning staff are amazing, really, just putting in the hours, helping the patients who were at our doors.
Thanks for watching the video. Be sure to like, subscribe, and hit that little bell for notifications. And also make sure to connect with us on Twitter, Facebook, and LinkedIn. For all of your business news, visit businessjournaldaily.com. For all of your arts and entertainment news, go to afterhoursyoungstown.com.
Built for the 21st century American workforce, Eastern Gateway Community College has 2 campuses and is a national leader in online learning. EGCC.edu is a digital gateway where 30,000 students are quickly transforming their financial futures through degrees, certificates, transferable credits, and higher paying jobs. And now, residents of the Mahoning Valley can enroll in summer classes for free. It's the EGCC Summer Guarantee. Eastern Gateway. America's new workforce starts here.